let's move on to question 3. Contestants, are you ready?
Yes.
Number 3, what gives you the most hope for healthcare? Now remember, we asked 50 respondents. Marc Briesacher, what does the survey say?
I would say that one of the most common responses should be just the confidence they have in their trusted clinician.
Confidence in their clinician, survey says. Any other guesses, gentlemen?
I would say, being a CIO, advanced technologies.
Advanced technologies, survey says. Technology and care advancements. He didn't mess around with number 2 or 3. Straight to the top, Mr. Probst.
Nice.
Can we see the responses, number 2 and 3? So gentlemen, let's discuss this, kind of disparate answers on this one. So obviously the clinicians on the panel are going to think that maybe number 1 makes a little bit of sense?
Tech makes sense, and you can understand, given all the investment we've made with meaningful use, all the clinicians are installing new electronic medical records and those things. It's going to be top of mind to a lot of people that does it. I mean, technology is just a tool. I mean, it's these smart guys as doctors that make those tools useful. But I think given how much we've invested and how technology's improved, I can see why that would be an answer.
Well, technology sounds sexy. Talk to us about the cost of technology and how that affects the cost of healthcare overall.
When you talk about technology, there's a couple different buckets to kind of keep in mind. The first, we're at the Cerner Health Conference. Obviously, health information technology, electronic health records, revenue cycle management systems, business management systems, they have a cost to them, especially on the side of making it work and getting it implemented and having everyone adopt it. There's other technology, though, as well, related to advancements in pharmaceuticals, advancements in imaging, advancements in new devices, and these are also significant drivers of cost. And we have to be really thoughtful about how these technologies are deployed so that we're making sure that we're adding value to the system, that they really truly make a difference in the care and the health of people.
So number 2 is a little bit shocking. Nothing gives people hope for healthcare. That's sad.
I think
what do you say to that?
I think it's a good message, and I think it's a message to listen to. I think it makes me think that people think, okay, healthcare is too expensive. I'm just talking about generally in the United States or even in other parts of the world. And it's hard for me to know what I need or to get what I need. And so you can see why they would, maybe say nothing. But in my mind, this is a very exciting time. We're now across the nation putting in information systems. We're starting to understand how to leverage those to get data, to get insight into what does make a difference in people's lives. So on the healthcare side, we're learning to apply technologies to make things better, to ask and answer the right questions. I think the other thing that gives hope is that each one of us has the choice, and I think we're starting to learn this more and more, to turn away from supersizing everything and turn more towards healthy food choices, exercise, paying closer attention to our own health.
Adjusting our own lifestyle.
And we can work on that together. So I think there's more hope now for our healthcare system than there's ever been. We've just got to take advantage of the things that are, available to us in our own lives through our own personal choices and the technologies that are coming out to make, things work better.
So how do you convince the public that is indeed the case? What do you say to your patients and others?
Well, I would argue that it's something that they have to experience. We can talk all we want about the fact that we deliver the best health care the world has ever seen. But whether it's cost, whether it's access, whether it's some other barrier, these are things that can make healthcare difficult. I actually think we're at a point where, with additional attention to consumerism, thinking more about what does the consumer need, what does the patient need, and us being more oriented around, can they have a visit on their terms and their time? Can we do it by telehealth? Could we do it asynchronously? These are things that could cause hope to rise in the public's mind as healthcare becomes more consumer oriented and really focuses on delivering the things that are important to them.
Great point.
Well, we really need to connect some of the technologies that are out there. I mean, Fitbit is a health care focused device. We need to give the public this understanding that when you're caring for yourself, when your steps are going up, you're doing better things. Think about it. I mean, who really, historically, wants to see their doctor? You not like these guys, but if you're going to the doctor, you're sick. or you might go for an annual checkup, but a lot of times you're sick. You go to the hospital, you're definitely sick. And that isn't a positive interaction, so I can see why nothing would be out there. But if we can shift the attention to these new devices, these portals, this information that's out there that's really meant to keep people healthier, I think it's going to change the attitude. I agree with Chris. I think it's going to create, and Mark, it creates hope, and it's going to change the attitude around healthcare.
Great comments. Any last thoughts on this topic?
Well, healthcare reform should be last.
Right. Well,
It's
Not so
difficult-
much promise there,
It's
huh?
difficult to reform healthcare. You'll have ideas about how that would be done, but it's difficult to inform it without unintended consequences. But I think the ideas that we've shared, of taking responsibility for our own health and taking responsibility to use the technologies that are being developed to find where the costs are and to improve the quality of what we're doing. Those are always going to be the right answers.
right.
Great. Gentlemen, thanks again. We really appreciate your time. This has been People's Choice by Intermountain Healthcare. Thanks so much for joining us, and go Cardinals,
Utes.
Cubs,
Go
or
Utes.
go Royals. Go Kansas City. Woo!